Welcome back to Informed Well, Episode 3. In each episode of Informed Well, I'll break down topic-related studies and articles so you can sit back, relax, and get the facts you need without all the hassle. So let's get informed well together. Today, you'll become engaged in a paper published in the 2023 Biomedical Journal number 46 titled Grounding, the Universal Anti-Inflammatory Remedy by Stephen T. Sinatra, Drew S. Sinatra, Stephen W. Sinatra, and Gaetan Chevalier. Abstract. Grounding or earthing is proposed as a significant remedy for inflammation, potentially serving as a crucial health intervention for modern society. Despite its benefits, grounding remains relatively unknown and underappreciated within the scientific community. The abstract suggests that a broader recognition of grounding's role in preventing inflammatory illnesses could revolutionize public health. Evidence from previous studies and testimonials underscores the Earth's profound healing effects on the human body. The abstract also highlights the evolving nature of health information due to ongoing research into various treatments for inflammatory conditions. It points out the challenges in selecting the most effective health advice, noting that a considerable portion of medical literature may be unreliable. The complexity of understanding absolute versus relative risk adds to the confusion, even among health professionals. Despite these challenges, there is a universal consensus that inflammation is the fundamental cause of most diseases. Inflammation is described as a localized response to trauma or infection that isolates damaged tissues until the immune system can remove foreign matter, damaged cells, and microbes. Chronic inflammation, also known as silent inflammation, can persist for years, damaging nearby healthy tissues and weakening the immune system. This chronic inflammation can pose challenges for healthcare providers as it may stem from distant, forgotten traumas or unrecognized dental issues, releasing toxins into the body. To manage inflammation, most clinicians commonly prescribe anti inflammatory drugs. While these drugs are effective in reducing inflammation related pain, they often come with significant side effects. In contrast, practitioners of integrative medicine employ various strategies, including anti inflammatory diets, targeted nutritional supplements, detoxification methods, mind body techniques, and grounding to the Earth's energy, which involves exposure to electrons and Schumann resonances. Earthing and grounding and the Schumann resonances. Summary. Grounding or earthing involves direct contact with the Earth's natural electric charge, or electrons. This practice is seen as a natural, non pharmaceutical, anti inflammatory therapy that is free, easy to implement, and improves quality of life. The research group refers to grounding as vitamin G, or electronic nutrition. This concept includes the Schumann resonances, which are electromagnetic vibrations in the atmosphere with a fundamental frequency of 7.83 Hz. These resonances are not uniform and fluctuate, affecting the motion of electrons on the Earth's surface, making it electronically active and dynamic. The Schumann resonances maintain a frequency of 7.83 Hz sustained by a global electrical circuit with three main generators: solar wind entering the magnetosphere, ionospheric wind, and thunderstorms, especially around the equator. Lightning strikes occurring thousands of times per minute transfer positive charge to the upper atmosphere, the ionosphere, and negative charge to the Earth's surface, inundating it with free electrons. These electrons, when absorbed by the human body, lead to favorable physiological changes. Previous research has shown that grounding can attenuate the inflammatory response, decrease red blood cell aggregation, improve heart rate variability, and positively impact blood viscosity. Increased blood viscosity and cardiovascular risk. Increased blood viscosity is emerging as a new risk factor for cardiovascular events due to its adverse effects on blood pressure, thrombogenesis, ischemia, and anthrogenesis. Interventions that reduce blood viscosity and red blood cell aggregation are particularly crucial in mitigating complications during the chronic viral pandemic of the 21st century, including COVID 19. Grounding and COVID 19. The onset of the severe acute respiratory syndrome, SARS, viral pandemic has necessitated the exploration of alternative remedies to alleviate the complications of COVID 19. Grounding has been investigated as a potential treatment for COVID 19 in two notable publications. One, case report by Ober and Oshman, published in the International Journal of Clinical Endocrinology and Metabolism. Anecdotal evidence from a case where grounding patches were placed on the chest of a woman during a COVID 19 infection. The patient's husband reported significant improvement, suggesting that grounding patches helped alleviate her symptoms. The study emphasized that inflammatory risk factors such as obesity, diabetes, and aging must be considered when assessing vulnerability to severe viral complications. 2. Observational study by Musa. Conducted at the University of Basra College of Medicine in Iraq, involving 59 patients with confirmed COVID 19 infection, grounding was achieved by patients walking barefoot on non insulated ground or using chest patches connected to a conductive metallic bar in the earth. Results showed that grounding patients did not experience blood clot complications, unlike those who were not grounded. Most grounded patients saw improvements in symptoms like fever, dyspnea, cough, weakness, headache, chest pain, body pain, and loss of taste and smell within 1 to 3 days. Among 20 patients with severe illness, 17 improved, 2 were lost to follow up, and 1 died. All 28 patients with moderate illness and 11 with mild illness improved, with no deaths reported. Musa concluded that grounding had significant preventative and curative benefits for treating COVID 19. These studies suggest that grounding can assist in preventing significant symptoms and aiding recovery from COVID 19. The assimilated electrons from the Earth act as quick acting antioxidants and help synchronize hormonal rhythms with the Earth's electric field. While further research is needed, the findings indicate that grounding could have a substantial clinical impact in managing COVID 19. The main life threatening complications of hypoxemia, coagulopathy, and overwhelming inflammation could potentially be mitigated by earthing, a therapeutic intervention with no known side effects. Rise in non communicable diseases. The healthcare system faces significant challenges due to the increase in non communicable diseases, such as cardiovascular diseases, neurodegenerative disorders, type 2 diabetes, chronic kidney disease, and cancer, which collectively cause 41 million deaths annually. Impact of aging. As life expectancy increases, the deterioration of the immune system, referred to as immune senescence, becomes a crucial issue. Oxidative stress resulting in inflammation and cellular damage is believed to be a key factor in the aging process. This oxidative stress leads to the cross linking of proteins, which may cause skin wrinkling and low grade inflammation in the brain. Type 2 diabetes is particularly prevalent among older populations, with 11.3% of the U.S. population being diabetic and 38% of adults being pre-diabetic. Modern lifestyles. Modern lifestyles, particularly the use of footwear with non-conductive materials, have contributed to a disconnection from the Earth's natural electric charge and the Schumann resonances. Historically, people wore leather or hide footwear, which maintained a conductive connection with the Earth's surface. Since the mid 1950s, however, synthetic soles have replaced leather, leading to a widespread disconnection from the Earth's natural energy. Figure 1 in the paper suggests a possible correlation between this disconnection and the rise in inflammatory related diseases such as diabetes. With 95% of modern shoes having non conductive soles, the paper questions whether this trend is coincidental or correlated with the exponential rise in diabetes. Other factors, such as the overconsumption of sugary foods, sedentary lifestyles, and high fructose corn syrup sweeteners, also contribute to the increase in diabetes. Research findings. Previous research in both animals and humans indicates that disconnection from the earth can lead to increased blood sugar levels. A study involving 12 patients with non insulin dependent diabetes mellitus showed that grounding to the Earth's field improved glucose utilization. The researchers suggest that lack of contact with the Earth could negatively affect diabetes, obesity, and high blood pressure. Hypertension and grounding. In a small clinical investigation focused on hypertensive individuals, 10 participants who were already on 1 to 3 antihypertensive medications took part. The study demonstrated that grounding, practiced for a minimum of 10 to 12 hours per day, led to significant reductions in systolic blood pressure levels. Specifically, participants experienced decreases ranging from 8.6 to 22.7%, with an average reduction of 14.3%. This reduction was substantial enough that many participants were able to reduce their reliance on hypertensive medications, highlighting the potential of grounding as a complementary therapeutic approach in managing hypertension. Other health benefits of grounding: inflammation and pain reduction. Research over the past decade has consistently shown that grounding can reduce inflammation and alleviate pain. By connecting to the Earth's surface, individuals may experience a neutralization of free radicals and a reduction in oxidative stress, which are key contributors to inflammatory processes in the body. Improved sleep quality. Grounding has been associated with improved sleep patterns. Studies suggest that grounding helps regulate circadian rhythms and promote deeper, more restful sleep. This benefit is attributed to grounding's ability to normalize cortisol levels and promote relaxation. Accelerated wound healing and improved blood flow. Grounding has been shown to enhance wound healing processes and improve blood flow. Research indicates that grounded individuals exhibit faster healing rates and enhanced circulation, which can have profound implications for recovery from injuries and surgical procedures. Effects on blood viscosity and cardiovascular health. One of the significant findings in grounding research is its impact on blood viscosity. High blood viscosity is a risk factor for cardiovascular diseases, including thrombosis and stroke. Studies have demonstrated that grounding reduces blood viscosity, thereby lowering the risk of clot formation and improving overall cardiovascular health. Autonomic nervous system and heart rate variability, HRV. Grounding has a notable effect on the autonomic nervous system, enhancing heart rate variability, HRV. HRV is a critical indicator of cardiovascular health and resilience to stress. Grounding sessions have been shown to improve HRV, suggesting potential benefits in reducing the risk of cardiac events and enhancing overall heart health. Specific studies and clinical findings. Neonatal care in premature infants. Research conducted at Pennsylvania State University explored the benefits of grounding in premature infants in neonatal intensive care units. Grounding was found to enhance the baby's relaxation and improve vagus nerve tone, potentially aiding in their developmental processes and overall health outcomes. Blood flow and viscosity studies. One of Dr. Stephen Sinatra's significant investigations demonstrated improved blood flow and reduced blood viscosity due to grounding. Thick, clumped blood is a hallmark of diabetes and cardiovascular disease. Grounding participants for 2 hours resulted in a 273% reduction in blood viscosity. A subsequent study using a commercial blood viscometer showed that grounding significantly reduced blood thickness during yoga sessions. Another study of 40 patients showed enhanced blood flow regulation and circulation to the head, face, torso, and extremities within a 1 hour grounding session. The results suggested improved facial blood flow regulation and skin tissue repair, indicating potential overall health benefits. Grounding may represent an effective preventative and therapeutic strategy for those with cardiovascular disease and diabetes. The University of Calcutta researchers noted a progressive deterioration of the zeta potential and hypercoagulability among patients with diabetes, worse than those with cardiovascular disease. Grounding, with its profound impact on blood viscosity, should be used as an adjunct therapeutic maneuver in those with advanced peripheral vascular disease and diabetes mellitus. Grounding and stress reduction. Grounding has documented beneficial effects on physiological and emotional stress, including normalizing cortisol levels, calming brain electrical activity, and normalizing muscular tension. Grounding also improves trauma and tissue injury response with accelerated wound healing. Among athletes, grounding has been shown to reduce inflammation, discomfort, and recovery time. Studies on delayed onset muscle soreness and cycling exercise demonstrated that grounding reduced muscle and protein breakdown and enhanced recovery, benefiting training athletes. Grounding supports energy production. Grounding provides cellular restoration and energy support by enhancing the mitochondrial function, which produces adenosine triphosphate, ATP, the energy source for all living processes. Electrons from the Earth serve as potent neutralizers of free radicals, reducing oxidative stress and supporting optimum ATP production. Modern lifestyles, notably wearing shoes with synthetic soles, have severed humans from their electric roots, leading to an unrecognized electron deficiency and contributing to chronic inflammation and diseases. Grounding restores the body's connection to the Earth's electrons, reducing inflammation, oxidative stress, and reinforcing the body's defense mechanisms. Summary. Clinical investigations indicate that grounding generates broad, beneficial, and significant physiological changes attributed to mobile electrons on the Earth's surface responsible for its negative charge. Lifestyle changes have disconnected most humans from this health resource, creating an electron deficiency that may contribute to chronic inflammation and diseases. Grounding improves cardiovascular health, reduces stress, enhances blood flow, and supports energy production. Physicians recommending evidence-based, harmless, and simple natural interventions like grounding can significantly reduce human suffering and improve quality of life. Grounding may become a premier preventative and therapeutic antidote for diabetes, cardiovascular disease, and other inflammatory illnesses. That's all for today's episode of Informed Well. Grounding might just be the simple, natural intervention we need in our high-tech lives. Stay tuned for more episodes where I'll bring you closer to understanding the science that shapes our world. Don't forget to subscribe and share this podcast if you found it insightful. Until next time, stay grounded, stay healthy, and stay informed well.